Good afternoon and welcome to the Alabama Public Health Training Network. We're delighted that you could join us today for the Back to School Toolkit training. My name is Carolyn Byrne and we are going to field questions today via email. The email address that you will send your questions to is now on the screen. We have responded to a lot of questions prior to this training today, and we are delighted to answer any questions. If we have too many questions, we will be screening those tomorrow and posting them to our website. So we welcome all Department of Education and Alabama Public Health people to the training, and I'm delighted to talk about our presenters, which is Dr. Scott Harris, our State Health Officer. We have Dr. Jonna Cotton, who is our Southeastern District Clinical Director, and we also have Ms. Susan Norman, who is our General Infectious Disease and Outbreak Investigations Manager. So we will look forward to answering your questions and sharing information today, and we're glad you've joined us. Dr. Cotton, do you want to talk about our resources?
I will. I'll start us off today. The resources for today include the Back to School Toolkit, and the website is listed below there that you can find the toolkit. We also have our data and surveillance dashboard, the risk indicator dashboard, and the website where you can find those is also listed. I want to go ahead and start today by going over the objectives for today. The first one is we want to review the risk dashboard, and this is a tool for decision making. Number two, we want to ensure that there's consistent and up-to-date COVID-19 mitigation information, and that it's being shared by our county health departments with local school systems. And we want to review key principles to consider for reopening our schools. Number four, we want to identify the school and the Alabama Department of Public Health roles when students and staff members are positive or symptomatic for COVID-19. Number five, we want to understand the guidelines for isolation and self-quarantine. And then the last objective is that we want to discuss how to report positive and suspected cases to ADPH. We also have developed a web page that's going to be located on our website under the COVID-19 page. It will be called the Schools K through 12. And this information that is on our training today will also be located there. We'll be updating that webpage frequently, but this is going to be a place that the schools can go to find updated information, and we'll be going through some of that information as we go along today. I'm going to turn it over to Dr. Harris now, and he's going to go over some of our information.
Okay, thank you very much.
You're welcome.
Thanks to everyone for joining us today. We appreciate you making time for this. It's a very important time for all of us. As you know, I have to begin by thanking the people who have helped to put together this information, many of them here in this room. This has been a terrific amount of work that has been done. It's hard to even describe how much work has gone into this with our folks here at Public Health, also with the State Department of Education. It's a tremendous effort, and we want you to see the information that we put together and understand why we are doing this and the purposes of what we're trying to do and trying to accomplish. And most of all, we want you to understand that we're here to be a resource for you and try to help you in these difficult times. I really also want to just acknowledge the difficulty that local schools officials are having to go through right now. This is a tremendously challenging time in all parts of society, and in no part is there more controversy than in schools. You know, it's a really delicate dance that everyone's trying to do. I would say no one's really had to think through the logistics of trying to open up schools in the midst of a pandemic, or at least not in my lifetime. I think there are a couple of items on which we can all agree, though. You know, one is that face-to-face instruction is preferable if we can do that. I think we all agree that kids probably do best when they can have face-to-face instruction. And at the same time, I think we can probably all agree that the more people that we have gathered together, the more opportunity for transmission of disease that could occur. And so we really want to make sure that what we do is keeping in mind the best interests of our kids, but also our teachers and our administrators and others. And we want to make sure that we're keeping in mind the best interests of what's going on in our state. We've certainly heard a lot of concerns from many of you that I'd like to mention up front, that guidance from public health is effectively a mandate to you. If public health gives you some guidelines, isn't that the same as just telling you what you have to do? I know many people feel that way, and I hope that you will not. We have not issued new health orders or mandates or tried to have regulations passed that would require you to do these things, and yet we believe it's our role in public health to give you the benefit of our medical expertise and try to help you understand what we think are the best practices that we can implement as we are trying to safely reopen schools. I would say that of the 80-something pages that are in this document that you have seen there just a moment ago, probably almost all of them, probably 80 of them, are directly taken from CDC. They're almost direct guidance from CDC. And so what you don't see is brand new guidance that's just been invented and to bring to Alabama out of the blue. This is the same guidance that consistently has been out there for months now that talks about ways that we can safely interact in the public sphere, and in particular how we can safely interact as we're bringing kids back together. So what I'm going to do is walk through with you a couple of our dashboards that we have available to let you sort of understand what information is on there and help you understand how you can use that information to make good decisions. Again, I think one of the most important things that we all have to recognize up front, and you probably recognize this already, is that we are going to have cases in our schools, and there's no question about that. Right now in Alabama, around 15 or 16% of all the tests that we do come back positive. So 15 or 16% of all of our tests. Now that doesn't necessarily translate to 15 or 16% of our school kids are also positive. I'm sure it's much lower than that. But even if you have 1 or 2% of your kids who are positive, when you're looking at 750,000 K through 12 kids in Alabama, there are going to be thousands of kids who are going to be positive on the first day of school. I mean, we know that that's out there, and as frightening as that may sound, I think that's just a fact that we're dealing with right now in Alabama and every other aspect of our lives as well, not just in schools. So we want you to understand that we recognize the very difficult decisions that you're trying to make, and we want to help you try to make those as safely as possible. We have been asked a lot about hard triggers for closing schools. What number do I need to see in order to close my school? And that's a normal question that we have been expecting and would expect you to ask. And yet I would say that there's not actually a one-size-fits-all solution for that. Every system is going to be a little bit different. There are going to be different factors that you have to consider. Certainly the amount of disease that's being transmitted in your community is one of the most important, if not the most important factor, and yet there are other factors that are going to be out there as well. It's been made very clear that in Alabama, local school boards are going to have the authority to make those decisions about whether to open or whether to remain open or if to close temporarily. And so that authority is going to rest with those school boards. And yet we are here to do everything we can to support your decision, to try to give you the best information that we have, to try to help you interpret the data and get a clearer picture of what's going on in your state. So I'm going to ask you to take a look, if you would, at the first dashboard that you see on the screen there. This is our normal external dashboard that you can get linked to from the ADPH website, which is alabamapublichealth.gov. This shows you the status of the state that's updated as of 10 a.m. every morning. You can click on each individual county and get an idea of the number of cases and the rates in each county. And then the right side of the screen shows the cumulative numbers for the state as a whole or for individual counties. If you look up in the top right corner, you can see a place where you can put your individual county there from a drop-down menu, and then those numbers will change on the right side of the screen to give you an idea of what the numbers are in your county overall, and perhaps more importantly, what numbers have looked like over the past 2 weeks. There are a series of numbers underneath the map of Alabama. You can see little tabs there, and each one of those tabs has a different type of information on there, showing you things like the percent of tests that are positive, or what the overall rate is in the community, or some other things that can give you an idea of what's happening in your own county, but also how you compare to other counties. Next slide, please. This is an example of what you can find there. This is a percent of positive tests that we have seen each week in Alabama since the beginning of the response back in March. You can see that the percentage of all tests that we do that turn positive has greatly increased up through about mid-July, although there's been perhaps a slight bit of improvement over the past couple of weeks, which we're happy to see. There's not a hard and fast number about a percent positivity rate that would automatically cause you to make a decision, but certainly we'd like to see the percent positive rate going down. We'd like the number of tests that are being done and return positive to be decreasing if at all possible. And this is information that you can find individually about your own county. Next slide, please. We have a second dashboard that's our risk indicator dashboard. And again, you can link to this from the alabamapublichealth.gov website. This is a map that's updated every week that's color-coded to give you an idea of the risk in an individual county. We actually have plans to have this map released by zip code level, not just county level. We're in the process of working through that now. It's logistically a little bit challenging, but we should have that available, and that'll give you a little more granularity within your own county, particularly some of our bigger counties where an entire community might be a single zip code, for example. We'll be able to get you a little more community level information, and we hope that'll be available very soon. But you can see the color scheme there is one I hope you're familiar with, but a red, orange, yellow, green that gives you some idea of the disease transmission that's going on in your community. Essentially, if you are a red color, it means cases are going up. The numbers of cases are increasing in your community. And then those are the counties about which we would be most concerned about ongoing transmission, particularly community level transmission. For the other colors, it means cases are decreasing, but for the orange counties, for example, they've been decreasing really for less than a week. And so they had been increasing, but if they've been decreasing, but only less than 7 days, then those counties are orange. And so given that this is updated only once a week, you can sort of guess at the factors that need to be considered when you're looking at what your county looks like. The counties that are yellow have had cases decreasing for more than a week, but less than 2 weeks, and then green counties have been decreasing for 2 weeks or more. And those are the ones about which we feel best when it comes to understanding community transmission. Next slide, please. If you drill down on an individual county, you can look at your county and see what the color is on your county. And then on the left side of the screen, you can see the factors that we use to try to determine what the color scheme is for a particular county. We look at the direction the case numbers are going, but then we also want to make sure that the case numbers aren't affected just by the amount of testing that's going on, or because we have lots of people in the community who have an illness but aren't able to get a test, for example. Those are all factors that have to be considered so that the case number alone isn't just taken in a vacuum, but taken in the context of how much testing is being done. I think the most useful part about this risk indicator dashboard is that it lets you see how you compare to other counties around to get some idea of what's happening in your own community. But also it's something that can change from week to week, and you can get a good idea of how things are trending within your own community. Once you select your own county, like in the case you see here, Montgomery County, then there's more specific information that you can have there as well. Next slide, please. For example, this can show the rate of cases. This is the number of new cases per population, and you can get some idea of whether you have an ongoing outbreak or not, as numbers are increasing or decreasing. This shows Montgomery County over the past several weeks, and you can see how cases have kind of ebbed and flowed depending on which month we're talking about. Finally, I'll show you, this is a percent positive graph that we have available for each county as well, similar to the one I showed you for the state as a whole. This shows you what percentage of all the cases being done and all the tests being done in the community, in a county, are returning as positive. I mean, obviously, we would like to see that number decreasing. You can see, for example, in this example here with Montgomery County, a peak in that a few weeks ago with somewhat of a decline over the last few weeks. And obviously, as the percent positive cases go down, that would be certainly a much more encouraging sign about what goes on in your community. I'm going to stop here in just a minute and turn this back over to Jonna, but I will tell you that we want to cover with you really what actually goes on within your own school, what you need to do when you have a suspected case or a confirmed case among a student or among a staff member. We have a diagram here that we'll walk through and help you understand what the school's responsibilities are and what ADPH responsibilities are. I think the main point I'd like to make before I turn this over to Jonna is that these are actually the kind of duties that your school nurses are actually already familiar with. These are exactly the same types of responsibilities that they have for other types of outbreaks or infectious diseases that go on now. Certainly not all illnesses in a school are things that have to be reported or that have to be traced by public health, but many of them are sometimes. And so even though there are a few specifics that we're going to cover about COVID-19, this is actually something that you should all be familiar with. It's not a new process. We are going to reach out to you all to help us a little bit in identifying contacts. If you have a case in a classroom, for example, it's difficult for us to ascertain, here in Montgomery, which kid was sitting next to that kid when they were in the classroom. And so we need your help a little bit in identifying those folks who are contacts. But the contact tracing aspect of this will continue to be done by public health, just like it has always been done. We're not asking you to take on that responsibility. This is a responsibility that we'll be doing in public health, although we will need your cooperation and help in learning to do that. So I'm going to pause at this point and mask back up and step off the stage for a few minutes and let Jonna pick up the next part of the talk. But we look forward to answering your questions. Again, we want to acknowledge the really difficult time that you're probably all going through right now. It's very challenging for all of us. It's really an extraordinary event in our lifetime, but we certainly want to do everything we can to help you and look forward to continuing to work with you. Jonna, thank you.
You're welcome. Okay, so we're going to jump right in and go ahead and start with the next section. Thank you, Dr. Harris. The first thing that we want to review are the COVID-19 symptoms and the key principles. And you should have this in front of you. If you don't, you can follow us along online. I'm sure that everyone has heard of some of the symptoms of COVID-19 by now. There's many symptoms that you can have: coughing, shortness of breath, fever, chills, muscle and body aches, vomiting, diarrhea, and now the new onset of loss of taste or smell. What's important for us to review those symptoms, we need to make sure that we're doing a good job of educating people of what those symptoms are. The symptoms can range from mild to severe and will appear about 2 to 14 days after someone has been exposed to COVID. We did put a really good handout in our toolkit, and we hope that you'll share that with your parents, with students, and keep a copy at home if you need to. There is a lot of other illnesses that can have the same symptoms as COVID. So it can be difficult at times to decipher if a student or if a staff or if even with yourself, if you have COVID or not. And we'll go through that a little bit later. But for right now, while we're in the pandemic, these are the symptoms that we need to look at and make sure that we get some type of clarification whether you have COVID or not. So the key principles to consider for reopening the schools, there's 8. And I want to start with social distancing. I'm sure that everyone by now knows about social distancing. This is not a secret that the CDC says that we should remain 6 feet apart. They recommend that we should stay away 6 feet with no longer than 15 minutes of contact. We know that COVID is spread mainly during close contact with people. So that's the purpose of the social distancing for 6 feet, no longer than 15 minutes. What schools can do to help social distance their students and their staff is to separate their desks 6 feet apart. I'm sure that this is not going to be feasible in every school district, but this is what the recommendation is. Remain 6 feet apart when you're walking through the hall. I'm sure everyone here has been in stores, in grocery stores. You've seen the lines at checkouts, at department stores, and you're going to need to carry that over into the schools. We're going to need you, if the students are moving throughout the school, that they stay 6 feet apart at all times. Face the students all in one direction in the classroom. The teachers should also remain 6 feet away from the first row of students. Every effort should be made to minimize close contact within the school. This should also be done on buses as well. Social distancing as far apart as you can space those students will help. Letting students in the same family sit together will also help. Keeping the buses with the students separated as far apart as you can will help with that social distancing. The next key principle to consider is facial coverings. The CDC recommends that all staff and students will wear face coverings when schools reopen. On July 31st, everyone is aware that Governor Kay Ivey's order for wearing masks was extended to August 31st. We know that COVID is spread through droplets, and this is the one way that we can mitigate the spread of COVID-19. All of these key principles that I'm going over are important. All of them are important to help mitigate COVID-19. But there are some that we really need you to do. We need that social distancing. We need those facial coverings to be worn by all students 2nd through 12th grade. I'm sure that it's going to be difficult for those younger kids. We also need the parents, students, and anyone that works at the school to be able to remind students to pull their facial covering up. We're not saying that it has to be a mask. It can be any kind of cloth covering. But we need to identify throughout the day if they've got their mask down, if it's down below their chin or if it's below their nose. The facial covering needs to cover the entire face, the nose all the way across through the mouth. So also face shields. The CDC does not recommend the use of face shields at this time for normal, everyday activity. There's just not enough evidence to prove that it works in everyday activity. The next principle is the seating charts in classrooms and buses. It's recommended that each classroom have a seating chart, that there's also a seating chart on the buses. The reason this is really important, and I'll show you a chart in just a few minutes of what a diagram will look like in a classroom if the kids can be kept 6 feet apart. But the reason that this is really important for us is because it's going to help if a student becomes ill in a classroom. If we have that seating chart available and the nurse can upload that seating chart, it's going to help us identify who the close contacts are in the classroom. So we would prefer that students remain in the seats that they are assigned. I'm sure that there will be incidences where instructors and teachers will have to move their classrooms around and change the seating of some of their students. We need you to update that seating chart when you do that. That'll be very important for contact tracing. The next key principle is student movement within our schools. This is really important, just like it is at department stores, just like it is in everyday activities. We need the students to stay as static as possible throughout the day. This means that if you can keep your students in one classroom and allow your teachers to exchange classes, that would help. That limits the movement of those students throughout the day. Also, if you can, again, keep them 6 feet apart when they're moving. If they do have to move throughout the school, make sure that they're social distancing as they're moving within the school. The next key principle is the meals. And the recommendation at this time is that students are limited to the number, that you limit the number of students that are in the cafeteria. One way you could do this is to have your students remain in their classrooms for recess and for lunch. This would limit the movement in the schools. This would limit you would be able to keep them socially distanced if they stay in their desk. And you would be able to limit the amount of people that are moving out throughout the school and in the cafeteria. This may not be feasible. We're aware that this may not be feasible for every school district to do this. But if you can, this is the recommendation. If you can take your students outside to eat and let them eat in other designated areas, what we want is there not to be a lot of congregating in the cafeterias. If you cannot do this and your students have to eat in the cafeteria, you will need to keep them socially distanced 6 feet apart. You may need to stagger your meals throughout the day. The students may have to stagger so that just 1 or 2 classes go at a time. This is going to be, a challenge, I'm sure, for the schools to be able to do this, but it's really important. We also need to let you know that if the students can bring their lunches and their prepackaged and disposable utensils, that would also help. If you're providing meals to your students, prepackaged meals with disposable utensils, the less that they are touching and sharing objects, the better off we will be. The next key principle is hand washing and the use of hand sanitizer. So we know that the best hand washing is done with soap and water for 20 seconds. We also know that this is probably not going to be feasible in every school. Every classroom may not have a sink. And in those incidences, you will need to have a readily available use of hand sanitizer that has at least 60% alcohol in it. We recommend that students and teachers wash their hands if they cough, if they sneeze, after using the restroom, and before and after meals. It just needs to be readily available to them. When they're coming in and out of classrooms, let them wash their hands. If you can make it where they don't have to touch the doors and the doors can be propped open, that will help. They may even want to bring their own hand sanitizer. If you can allow that, it can stay on their desk throughout the day and they will have it. And there's handouts in the back of our toolkit showing students the proper way to wash their hands. So if you can use this as an education tool, that would be wonderful to be able to give parents. They need to be doing this at home as well. And the last key principle for reopening schools is cleaning and disinfecting. The most important thing we need to know about this is that you're going to need to have your schools cleaned frequently. All surfaces that are touched frequently will need to be cleaned daily, and this includes the schools and buses as well. If you can limit sharing of objects, that's what we recommend, but if not, if you are having to share objects and the students are having to share objects throughout the day, those objects will need to be cleaned between use. Also, make sure that you're using products that meet the EPA disinfectant criteria. You can find this on CDC's website, and we have it in the toolkit as well. We also want to recommend that and let you know that you should never store any cleaning or disinfectant products anywhere that children can get to them. And also be careful how you use those cleaning and disinfectants around small children. The next part that we want to go over is our classroom COVID-19 positive and isolation quarantine guidelines. This is the, let me get to it. This is the what Dr. Harris was talking about earlier, and it's in the toolkit. For the past few months, we have been asked multiple questions about what we were going to do, what to do, what the superintendents need to do, what do the nurses, what's their role if a student gets ill at school, or if you find out that the student is positive at school or even after school. So we wanted to put this little, kind of like an algorithm together, and we're going to go through it. The first thing that I want to remind you is that a close contact is defined as those students or staff that have been within 6 feet of one another for at least 15 minutes. That's called the 6-15 rule. In order to help us determine that 6-15 rule, when a person gets sick or tests positive, that seating chart for those buses in those classrooms are going to be very important for us during this time. It's going to be very important for our case investigators to have that seating chart so that they can look and see who qualifies for that 6-15 rule. In the red box on this piece of paper, on the scenario, I want to read this because this is important. Per our notifiable disease rule, the healthcare provider, school nurse, or principal should immediately report COVID-19 positives or suspects to public health using our online Alabama Department of Public Health report card. That report card is going to be listed on that web page that I mentioned at the very beginning. So it's going to be very easy for you to click on that web page, go straight to that report card, and report this. This is not any different than notifying us of any other disease. But we really need this to be done for suspect cases as well as those that are positive. So step one, we're just going to go through. I want to first start and say, if you have a student that gets sick at school, this is what we're going to follow. If a student tells their teacher that they're feeling bad and it's one of those symptoms of COVID, what needs to happen, the very first thing that needs to happen is that child needs to be removed, or if it's a teacher, or if it's an employee of the school system, they need to be removed and put into isolation. We are recommending that every school have an isolation area designated for sick students and sick employees. When you isolate that area, make sure that the seating, the beds, however you want to do your room, make sure that everybody is 6 feet apart still in those rooms. But you are, because you may have more than one student at a time in these rooms, and you also want to keep confidentiality, remember confidentiality in these isolation designated areas if at all possible. But for a student who becomes sick at school, the first thing you're going to do is you're going to take that student and you're going to move them into isolation. Hopefully they already have a mask on, and you're going to put them in the isolation room. They are going to stay in that isolation room until their parents can come and pick them up. or until they can drive themselves home. You know, whatever your protocol is for sending sick children home is what you're going to follow. Even with COVID, you're going to call the parents. If it's an employee, if it's a teacher, they're going to be allowed to go home. But the most important thing is that you get them out of the classroom or get them out of the setting that they're in and get them into this isolation area as quickly as possible. If that student that you've moved into this isolation room goes home and the next day the parent calls you, or the next couple of days, because the first thing that you need to remember, if that student goes home with symptoms, they're going to need to go home to stay. If you can encourage the student to go see their primary care physician, that's what we want you to do. We would prefer that the employee or the student goes and sees their primary care physician. Because not everything is COVID. And if it's not COVID, then that student should be able to return to school. And that physician, that nurse practitioner, their primary care provider can give them an excuse saying it was not COVID, this child had strep, this child had, you know, an ear infection, you know, or whatever, stomach virus, whatever it is, they can get that return to school slip so that that child can come back to school. If that's the case, then those contacts that we've contacted in the room that have been close contacts, if the school nurse has already said, you know, that there were close contacts, they can come back to school as well, as long as we know that it's not COVID. If the child that's sick goes home and does not go to see their primary care provider, and there are symptoms of COVID, that child is going to need to remain home for 14 days. Anyone that is a close contact to that child will also have to remain home. If that child tests, if the child that's sick goes to the primary care physician or goes somewhere and gets tested for COVID, and that test is negative, they still have to remain home for 14 days. That's really, really important because we know that sometimes you can have a negative test but still have COVID, and that's why we send students home. That's why we send people home when they get tested. We want them to go home and stay at home because we don't know, they could be positive, you know, within a week. They could have a positive test. So that takes care of the student if they are symptomatic, if they go to their physician, if they test, or if they don't test. However, if you have a student that gets sick or an employee that gets sick and they go home and they call you back and tell you that they're positive, they're going to be quarantined for 10 days, and then 24 hours after that 10 days, they're going to need to remain home 24 hours after there without fever or any medication for any of the symptoms that they've had. So you're sending a positive case gets to stay home 10 days. A negative case or someone that doesn't test has to stay home 14 days. And that's because of the viral load, the shift in the viral loads. So you've got two rows here, symptomatic, positive. Now, what is the role of the school for these students? So if you look down in step 2, what we're going to need you guys to do is to identify the close contacts to anybody that is symptomatic that comes to school or that's in the school. The school nurse can help us determine who those close contacts are. She can get that seating chart. She can start writing down names, and she can report that in the report card, which is very important for us. The close contacts in the classroom will also have to be isolated. We talked about that up here. And they'll be sent home. Whatever the protocol is now for you, that's what we're going to want you to use. Use the same protocol that you use now for reporting. If you send, during flu season, if you send students home, this is the same principle. You're going to send close contacts home that have been exposed, that possibly could have been exposed. So the school nurse is going to be really important during this time. I know that there are schools that do not have nurses. But those nurses, there are nurses that are assigned to the schools that there's not a school nurse in the school. So we are hoping that the Department of Education will be able to hire more school nurses so that there can be a nurse in every school, even more than one possibly. Anyway, in step 2, we're going to go ahead. The school nurse is going to be very valuable during this time to help us locate these contacts, get the information out to the contacts. And then the next thing that you're going to need to do is you're going to need to aggressively clean and disinfect. And that's when you're going to use those CDC guidelines. And we place those in the back of the toolkit. The next page is that you're going to need to report that to ADPH. We've already told you that. That's going to be one of those things that either the principal or the school nurse can do for us. You can also upload that chart, that seating chart, whether it's a bus. You may have to do both. If the child rides the bus and is sick, we're going to need you to do both, upload both. And of course, all of this will be listed on our website. Step 4 is the school communication with the parents. You're going to need to notify parents and any guardians and school staff that their child may be possibly a contact. And you need to remember that confidentiality and privacy must be maintained. You are not to tell them the student's name or the teacher's name. You are to tell them that they possibly have been exposed and that the Alabama Department of Public Health case investigators will be giving them more information. It's also important to remember that when you do send these students home, make sure that you let them know that they may be contacted by Alabama Department of Public Health case investigators. They need to answer their phones, and they will be given instructions. They will be given quarantine instructions or isolation instructions. They will be given instructions on how to follow up if they need to. So just, you may want to, there's a handout in here that we put in here to give those students as they're walking out, or to give the parents, and to reinforce that they probably will be contacted by us to follow up. And then down in the bottom, it's going to say, it says that public health will investigate and contact and conduct the contact tracing. I want everyone to remember, we will do the contact tracing. That's our job. We will take care of it. But we will need help from the schools, and that's why this toolkit is so important. We want to work with our local districts, our local school districts, so that we can do this contact tracing and try to prevent schools from closing, try to prevent sending the entire classrooms home if it's not necessary. Also, the public health staff will work with the patients, like I said, and they'll have them recall anyone outside of the school that they might have been in contact with. If they've traveled, if they've gone to church on Sunday and they've tested positive, on Tuesday, we're going to need to know that too. And the handout in the back does give that information. This next algorithm, we just developed this because we thought it was important for you to be able to see what it would look like for us when you have this seating chart. So this is how we believe the seating chart will look with the student's name. If you can keep them 6 feet apart, that's wonderful. But we need a seating chart even if they're not 6 feet apart. If you're opening your schools, we need to know where these children are sitting. It's going to be very important. And you can see where we start over here, the first block, schools with seating charts for classes and buses will improve the efficiency and effectiveness of our case investigations. Without the seating charts, the entire classroom would probably need to be sent home because we would not know who's close and who's not. But if you have the student sitting in the number 1 seat over here and he becomes positive with COVID, you can see where only 2, 7, and 6 might be the close contacts. if they remain in their seats, if they're wearing masks and they're 6 feet apart. So there's a lot into that contact tracing. There's more to it than just having this and them staying seated. But it does help, and it will help our case investigators. Again, it says doctors, school nurses, or principals are required to report the COVID-19 positive cases online through the report card. We would prefer that you do it within 4 hours of being notified. And then you can see the arrow going to the right. The report card includes a list of student, staff, guardian names, and telephone numbers. That's going to be very important for us so that we have that information so that we can call the students and anyone that's been possibly a contact. If you go down, the case investigation will begin, and then over the contact tracing, that's still our job to do that. We will take care of this. The self-isolation will occur until students and the staff are contacted by us and given information on what next steps they will need. Our nurses and our contact investigators will contact them. They'll give them the information. They'll mail them paperwork if they need it. They'll be in contact with them. So I'm happy today to have Susan Norman with me. She's joined me on stage up here. She is one of our nurses from our infectious disease and outbreak department. And we're going to just kind of go over some quarantine and isolation guidelines. Thank you, Susan, for being here with me today.
I'm going to jump in and just interrupt you for just a second because we are getting an awful lot of questions. So before we move on, if you don't mind, and we do want Susan to speak, but I'd like to just ask y'all, the first question we have is just about the 6:15 rule. So are the 15 minutes consecutive or cumulative?
Cumulative.
Cumulative. Okay, so that was our first question. We also are getting a lot of questions, and I just want to reiterate about contact tracing. Our contact tracing is being done not just by the disease investigators that you see listed in our resources. We have a list of disease investigators, and there are 2 in some areas, 1 in other areas, but we are contracting with many, many more contact tracers that will be doing this job. And I also want to make just a distinction because I think people think we have to know where the child is sitting and who is near a child that becomes sick so that we can do the contact tracing. So we are not asking school nurses to do contact tracing, and that's been a big discussion item that I see coming up with a lot of the questions here. We just want to reiterate, we have to have information in order for us to contact trace. So do you all want to, and I'll turn it over to Susan or Jonna, do you all want to talk a little bit more about how this is flowing so that they're not thinking that they're going to be doing contact tracing, or maybe we need to distinguish about contact tracing and what that means. So Susan, I may turn that over to you or Jonna.
Let me just say that the school nurses will not be doing the contact tracing. They're going to need to do the isolation. They're going to isolate. Their job is to isolate those students. As soon as those students or those staff members become sick, their role will be at that point to remove those students and put them in an isolated area so that the parents can come and get them. They will also need to educate the parents on what the next step is going to be once that child is sent home from school. They need to be able to tell them, your child will probably have to go home for 10 to 14 days, depending on if they're positive or if they're negative, or if they don't test at all. So the school nurses do not, and I apologize if I made that sound like the school nurses were going to be doing contact tracing. That's not what I meant, but we are going to need their help.
Right, and that's where they're going to provide with the seating chart, and they will upload that to the report card. So we would need to know the child's name, their date of birth, and contact information. So that's the part that the school principal or school nurse plays in that role.
And uploading those seating charts is how our case investigators are going to actually be able to know who the close contacts were if the child is positive or if they're symptomatic.
Because they will not know who to contact unless we have that information.
Okay, thank you for making that distinction.
You're
I think
welcome.
there's a lot of confusion about identifying contacts and then investigation and contact tracing, so I appreciate that.
And also, Carolyn, a point that we need to just go ahead and say is that if someone is unsure, there are people that they can call in their local district that can answer those kind of questions. And I don't want anyone to think that they're going to be left alone at school, any school nurse left alone and not have someone to call. There's going to be people within their district that they can call. This is being done so that our nurses in our local health departments can help guide them through problems that they're going to face in the school.
And that's a really good point, is we don't even know what kind of things will come up.
That's right. And everything is changing. You know, the guidelines are changing. The symptoms have already changed since we've started this in March. So everything is going to be changing, and that's why we needed this toolkit. That's why we need good communication between our local school districts and our local health departments. So, and we'll help guide the schools through this. We probably won't have all the answers, you know, but I think that we've got to equip our nurses at a local level who work for Alabama Department of Public Health. Just like we need to help the school nurses, we need to be helping our nurses so that they can help guide the nurses. And we'll do that.
Thank you so much.
You're welcome.
And I just also want to mention to everybody out there, there's been some overwhelming downloading of the school toolkits, and we know y'all are having some problems accessing them. So that is being worked on. It may be fixed now, but I just want to reassure you that everything is posted to our schools K through 12 website. So please know that you can access these resources, and we will be adding to them. And Susan, I'm so sorry that I interrupted
That's fine.
your flow to take some questions. Thank you.
So I'm going to review the isolation and quarantine timeframes for COVID-19 for non-healthcare personnel. And this is being added as a resource on our the web page that's been created, the schools K through 12. It may already be there, but if not, it will be there soon under the resource tab. One of the most important things is that we understand the key terms when we are talking about isolation and quarantine. Isolation, that refers to where you separate a person with an infectious disease like COVID-19 from people who are not sick, okay? That is considered isolation. For quarantine, that's where you separate people who were exposed to an infectious disease to see if they may become sick. So as a school nurse or as the teacher, when you have a student who all of a sudden they say they do not feel well, they feel like they may have a fever, or any of the symptoms of COVID-19, you would want to isolate. And by isolating, that means that you're going to take this child and you're going to isolate them away from the children who are not sick, okay? That would be a teacher or any staff member or student. Quarantine is where they're going to stay home for the time frame wherever they fall, whether they be symptomatic, a positive COVID-19, or they're a close contact. Another thing that is important is that we understand what it means to be a case and what it means to be a close contact. A case includes anyone who has tested positive with a molecular or antigen diagnostic test, whether or not they have symptoms. And that's real important to know, whether or not they have symptoms. Cases also include close contacts who develop symptoms consistent with COVID-19 but may not have been tested, okay? So a person who has symptoms that are consistent with COVID-19, they would be considered a case, okay, even if they have not been tested. And then the close contacts, it's usually defined as being within 6 feet for at least 15 minutes and includes household contacts, intimate partners, and in-home caregivers starting 2 days before symptoms or specimen collection date, whichever was earlier. So you have a teacher or a student who has a fever, and they have a runny nose, maybe even some nausea and vomiting. If they become sick at school, the close contact would be someone who was within 6 feet for at least 15 minutes, okay? That's why those seating charts are so very important, and we here at ADPH need those seating charts so that we can continue with our contact tracing. So cases include symptomatic close contacts. You must be isolated for at least 10 days after symptoms first appeared, and at least 24 hours has passed since the last fever without the use of fever-reducing medications and symptoms have improved. Symptoms may include, it could be a cough, shortness of breath, difficulty breathing. All of a sudden, you're not able to taste or smell anything. And the severely immunocompromised or persons with severe illnesses may be infectious beyond the 10 days, so that's something to take into consideration. And they should isolate for at least 20 days. And for these individuals, to end isolation early, it does say that 2 negative PCR tests collected more than 24 hours apart may be used. And that is for the severely immunocompromised. And I know that we have, that does fall in the schools as far as students or even staff. But cases who never develop symptoms may discontinue their isolation 10 days after the collection date of their first positive PCR specimen.
Susan, can I just interrupt with a question, because I think this might help?
Okay.
So just to give an example on the 10 days and then the 24 hours with no symptoms. So we have a student or an employee that experienced symptoms but tested negative with a rapid test, but they still have symptoms. They have a negative rapid test. Are they required to quarantine if they no longer are experiencing symptoms?
If they experience symptoms, COVID-like symptoms, and their test was negative, they would need to complete the quarantine for 10 days, and they would need to be the plus 1 day, the 24 hours, where they are symptom-free.
Thank you.
Okay. And then the close contacts without symptoms, they must be quarantined for 14 days after the last or most recent contact with the case when the case was infectious. The test results, whether they're negative or positive, cannot shorten the 14 days. So you have a close contact who did not have any symptoms. They're a close contact. They go to be tested and they test negative. They would continue to quarantine for the 14 days because they did not have any symptoms, okay?
Because we know that they can still become positive during that 14 days, and that's the rule, and that's the guidelines that we're given. So I think that's important for people to remember that. Is that correct,
Right.
Susan? Okay.
That's right.
So Jana, give us an example in a classroom.
Okay, so we're going to give some examples on our next slide. Can we go
Yeah.
ahead and move when we
Go
move?
ahead.
Do you want to let's go? We have some examples right here. The first scenario is close contact with someone who has COVID-19 but will have no further close contact. So let me read the scenario. I had close contact with someone who has COVID-19, but I will not have any further contact or interactions with the person while they are sick. An example would be a student is a close contact with another student. You have two students sitting next to each other. One becomes positive for COVID-19. The other one does not. The other one is a close contact. We send them both home. The positive goes home. The close contact goes home. Tell us how long that close contact has to stay.
14 days.
Exactly. That close contact, your last day of quarantine is 14 days from the date of the last close contact. And we have this example in our toolkit. So that close contact has to go home for 14 days if they are next to. If you are married and your spouse comes home and he tests positive, I better save that one. I better save that scenario because we do run over that one too. But if your spouse comes home and he's positive, you have to quarantine with him because you're a close contact. Right? The next scenario is and this is confusing, and I know this is confusing to people. It's really, it can get very confusing. You have to really read through every case, and every case is different. I keep my quarantine guidelines with me in my purse at all times. I have the one for healthcare workers, of course, because that's who I work with. But I keep that with me, and every time if we have a case, I go directly to my quarantine, and I have to read my isolation and quarantine guidelines for every case because every case is different. And I want to make sure that I'm telling someone the correct information. So the next scenario, close contact with someone who has COVID-19. I live with the person but can avoid further close contact. This example is a student comes home and they have COVID-19. They come home. They live in a household with 3 other students, but they are not going to be in contact with those other 3 students that go to school. They can isolate them in a different part of the house. The guidelines say that the last day of quarantine is 14 days from when the person with COVID-19 began home isolation. Did you get that? It's very confusing. But we did do a map.
Okay. So you have a student who came home and they tested positive for COVID-19.
Yeah, I live with someone who has COVID-19. An example is a roommate, a partner, a family member. And that person has isolated by staying in a separate bedroom, and I've had no close contact with that person since they isolated.
Okay, so the 3 other students, they're going to be
quarantined for 14 days from
their last
contact with
right.
that person.
Mm-hmm.
So the other 3 students in the home, no matter what grade they're in, no matter what, because they're not going to have contact with that student anymore, they only have to isolate for 14 days. Because you're isolating to make sure that they do not have symptoms. We know that they've been with that student before they tested positive. Now we're we're isolating those other students to make sure that they do not develop the symptoms during that 14-day period. So the next scenario is where it gets tricky. So you're under quarantine and you've had additional close contact with someone who has COVID-19. So this is the example, and this is where it gets very confusing. If a student goes home with COVID-19 and there's 2 or 3 other students in the house with that student, they are going to need, and they cannot isolate themselves. They're going to be with the person that has COVID. They have to wait that positive, the one child that's positive will be finished with quarantine 10 days and 24 hours. The other 3 students will need to stay at home for those 10 days, and then their quarantine period will start 14 days
From the last contact of the COVID positive.
of the COVID positive. And there's examples in here. We put examples with the calendars in here. It's very easy. I mean, it's confusing, but it shows exactly how the quarantine periods will start for all of these scenarios, because it does get confusing. It does.
So, but Susan and Jonna, public health is here. That's where the contact tracers will start advising.
Yeah, the schools should not have to worry about this.
Right,
All they're
that's
going to be
my
worried
point.
about is having the students get home and get the educators home and give us the information to follow up with all the contacts that could possibly have been, come in contact with the COVID-19 cases or the symptomatic patients. This is answering some of those questions, Carolyn, that we've been asked over the last several months. Because superintendents, school nurses want to know what's going to happen to those students. Parents are asking, how long does my child have to stay at home? And if I've got 3 kids, does that mean that I'm going to have to send all of my kids home? So this is why we put this in here, so that they could have an understanding of what, if they call our health departments, the school nurses will be given this information. And, whoever they talk to, even if it's a case investigator, can kind of go over the scenarios with them and say, yes, those 3 have to stay home as well. But all of that information will be taken care of by Alabama Department of Public Health, not the school nurses and not the schools. That's our responsibility.
Okay, and I want to go back. I think that there's been some confusion. We are using a symptom-based strategy
Right.
when we deal with schools and students, and there is no requirement for testing after they isolated and quarantined. So I think that was mentioned earlier, but I think that was in a special circumstance if somebody is immunosuppressed.
Right.
So we.
I think that's not for students, though. That's more, I guess if it could be for students if they have, multiple illnesses. And I think that's going to be based, too, on what their physician says. Their physician may want them to have, further testing. But from our standpoint,
Right.
we are doing it symptom-based.
Right. So we just want to clarify the fact that we are not expecting students to be tested to come back to school.
No. We are going to say that they need to finish out their quarantine and isolation, though.
Right.
Based on whatever the case investigators tell them. And at that time, I guess it's up to the schools whether they want to move them over to virtual learning at that time. And I think that's going to be the local school district's decisions to decide, what are they going to do what's going to happen to those students. I would suspect that they would just be switched over to virtual learning during the time that they're home.
Okay, and I just want to go back to close contact because we're getting a lot of questions around close contact. So let me give you an example. We have a student sitting more than 6 feet apart with a mask. Are they a close contact?
If you can get, this is.
Now, say that again.
Okay, we have a student sitting more than 6 feet apart with a mask from a student that becomes symptomatic.
Whether they're masked or not, if they are more than 6 feet from that student who started having symptoms, they are not in close contact with that person.
Okay.
That's why that 6:15 rule is so important. If schools can separate the students and keep them 6 feet apart, have the students wear a mask, the whole classroom won't have to go home because they would not be considered a close contact, Carolyn. I think that's why the seating chart is so important. But I could see that if a school is unable to keep that 6 feet distance and guarantee, I think that it's going to, I think that when the case investigator or when the school nurse goes to the teacher and says, I need your seating chart, were these kids, they've been staying 6 feet apart all day and they've had their mask on? If instructor, the staff member can say, yes, they've been in their desk, until he got sick, that was the first time. We've eaten lunch in here today. We've not been anywhere. They've been to clearly, they're keeping their distance. They're doing the measures to mitigate COVID-19, which are what those key principles are. And that's why those key principles are so important for schools to follow and to try to adapt and make routine in their daily school routine.
One more question. So we have a child that spends less than 15 minutes, 12 minutes within 6 feet. Are they considered?
Are they masked or unmasked?
Well, it's not the issue of the mask. It's whether they were less than 6 feet, but they were not with them for more than 15 minutes.
Right.
So they would not be considered a direct contact.
Okay. So they are not considered a close contact.
That would be, and you have to think about that realistically when you go into the grocery store. If you go into a grocery store and you're running in to get a gallon of milk, hopefully you're in and out within 15 minutes. You would not be considered a close contact if the lady at the checkout counter tested positive for COVID. Because you've spent less than, we've got a plexiglass up, they keep us distanced in the grocery stores, and it's less than 15 minutes. So you've got to use, you've got to think about it. And it does take thinking. You have to walk through every case, and that's what's going to happen. And those are the questions that we expect our nurses to be asked.
I also want to just mention additionally that the Academy of Pediatrics and the Academy of Family Practice are going to be working with pediatricians and family practice doctors to bring them to the team approach in communities. So we will have doctors that will also be helping schools make decisions. And so I do want we have lots of questions coming in, I do want to reassure the school systems that they will not be left alone. They'll have public health,
Right.
and we have providers that are stepping up to help with these different case scenarios. So thank you. Thank you very much. I will turn it back to y'all.
Do you want to go over the last scenario? You want me to read that? The last scenario on here is, I live in a household where I cannot avoid close contact with the person who has COVID-19. I'm providing direct care to the person who is sick. We do not have separate bedrooms to isolate the person who is sick, or we live in close quarters where I'm unable to keep a physical distance of 6 feet. So according to our map, the person that has COVID-19 would start their isolation and go 10 days and then 24 hours.
Their quarantine.
Their isolation. Their quarantine. Yeah, the sick person. I'm sorry.
Okay.
They would start their quarantine and go 10 days with 24 hours. The person who is caring for them would begin their isolation
Last day.
the last
Their
day after the
quarantine,
24.
The quarantine.
Their quarantine. Sorry. It is confusing. I get confused. Okay.
So the good thing about this is superintendents and principals, you don't have to worry about the scenarios.
Exactly. Okay, we're going to go ahead and move forward. The 3 steps to take, I wanted Susan to talk about this too. There's 3 steps that everyone needs to take while you're waiting for your COVID-19 test results. This is really, really important because I think people go to their doctors, they get tested, they think if they're negative, they can just go back to work, they can go back to school. That's not the case. Do you want to talk about it, Susan, or do you want me to?
You can go ahead.
Okay. So the first thing that we want you to do, if a student goes home, if the principal goes home, if a superintendent goes home, or anyone, the first thing that you're going to need to do is stay home and monitor your health. If you go and get tested, you're still going to need to stay home. Even if you get a rapid test that tells you that you're negative, you still have to stay home, okay? We need you to think about all the people that you've been around recently, not just in school. We need to know who you've been around for the last, week or so, especially from when your symptoms started or from the day that you got tested. And then we need to make sure that you answer your phone call from the health department. We did put a handout in the toolkit with these measures that we would like for everybody to have a copy of if you need those, and you can share those with people that you know at the school that are going to go and be tested.
So with those 3 steps, the person that has been tested for COVID, they were tested because they had symptoms.
We have some people that we know are getting tested that don't have symptoms.
Did they have direct contact with anyone?
I'm sure there's people that are being tested because they want to know if they have it or not, and they're asymptomatic. But that's not.
That would be one of those case to case, and we need to talk through that one.
I mean, you know, we are testing at Alabama Department of Public Health, and of course the people that we're testing are symptomatic or have, you know, illnesses that they meet the criteria for our testing. Some people, though, that test at, you know, I'm sure there's people that test negative that think that they're negative, but if they're testing, even if they're negative, it doesn't mean that they're negative forever. It means that they're negative the day they got tested, which can also be confusing to people, I think. You know, they need to know that.
So I think you need to know if you're being tested because you had if you had symptoms related to COVID-19, you were tested and your test comes back negative, you would need to continue to quarantine for the
14 days if they're
Yes.
asymptomatic.
Yes, if they're asymptomatic.
So I could see that happening.
Well, the asymptomatic would be that they had contact with a known COVID.
Okay, so like
So
I
if
could
they
see
become symptomatic with COVID-like symptoms, then they would quarantine for 10 days plus the
24
1.
hours, yeah. So
Even if they tested negative.
I could see this happening with a mother who has, or a parent, a father who has, you know, kids. Maybe they're a nurse and they, you know, contract COVID-19, and they want their kids to be tested to see if they're positive as well.
Well,
and
see,
so
that
I
would-
could see where that would, you know, that may happen with some of our school kids.
That would be a scenario where they were a close contact to a known
Right.
positive, and then they would need to quarantine for 14 days.
But they
if they
wouldn't
were
really even have to
asymptomatic.
be tested, is what I mean, they could just quarantine and not be tested. Because either way, they're going to have to stay home.
So I think that we need to focus
Right.
on the fact that you have close contacts, and I think from the school's perspective, we define what a close contact is. Then we can also have scenarios where you have a contact of a contact, which may also be confusing to everybody. But I think that is where public health and the pediatric community will step
help.
up to guide. So I think that the point is that when a child is sent home, then public health will do contact tracing.
Right.
We're going to have a group of disease intervention specialists that can be consulted. Our local health departments, we're going to have contacts at our local health departments that can be contacted, and we'll get information out to Jennifer Ventress on that. Because I think these scenarios are so confusing that we don't want to get into the weeds on all of the exception and things that can happen. Because I'm sitting here and getting a little bit confused.
And it is confusing, and I apologize. I do. You know, I want everybody to hear what we've been hearing, and the scenarios that have been presented to us, because this is what's been presented to us, Carolyn,
Sure.
over the last few months. You know, the exact scenarios that we're giving y'all is
They can contact us and we can contact
okay.
Yeah.
So y'all, the school nurses can contact.
anytime.
Okay, they can contact you, Jennifer Ventress, and then they can contact us. Jennifer can contact us, and it is very confusing. And I know I've probably confused people today, and I don't mean to do that, but it is life and it is real, and this is what we're faced with every single day, having to walk through all of the scenarios just like I'm doing today, and try to figure out who goes, who stays, how long, is it quarantine or is it isolation, and those are really. That's what we are looking at. Even the case investigators, that's what they're going to look at. Close contacts, who goes home, who stays, and how long they stay. And do they quarantine or do they isolate? But the school nurses, again, and the schools will not have to worry about that. But these are the questions that they are proposing to us.
Right.
So that's why we added these into the toolkit today.
And I will say, as your statement about the ADPH would be contacting anyone that has been sent home, there's guidelines being worked out about that as far, so we can't say that someone, just for example, they have a runny nose and they're sent home because that's a COVID-like symptom, that ADPH will be contacting but I don't want to get you confused, so we're just going to kind of.
But I think that's when it's important for that child to be seen by their primary care provider so that he can distinguish whether it is, allergic rhinitis, a common cold, or whether it's COVID. And if it's one of the other things, they will give them an excuse to return to school. The child may be back in school the next day if the primary care provider can distinguish that it's not COVID. And like I said before, there's a lot of illnesses that mimic and that have the same side effects that COVID do. And so that's why it's going to be important for those school nurses to say to the parents, we need you to take him if you can, and make sure that it's not COVID. If it's something else, then he can return to school with a doctor's excuse. And that would probably be the safest.
Otherwise, they will
have to stay at home.
For their quarantine.
For the quarantine, that's right.
Okay. And I'm sure we have lots of questions coming on that.
I'm sure.
So what's the next slide?
So, and I think go back to the nature of this virus. The reason this is such a unique situation and that we have a pandemic is that this virus, you can pick this up anytime between 2 days and 14 days of getting affected.
Absolutely.
And then sometimes we have people we have anywhere from 30 to 40% of our population that are asymptomatic. And so having asymptomatic, you don't even know you have it and you can be spreading it. So it is a very unique virus that none of us have ever dealt with before. And I think that's what's so complicated, and that's what the school systems, that's why it's so confusing.
And it is very confusing on a daily basis.
Yeah.
But we're going to work together and we're going to get through this. We are.
Yeah.
We're going to get through it. We're going to work together. And I think working with the Department of Education, the school nurses, our nurses in public health, our case investigators, our nurses that work in infectious disease. I mean, I think that it's going to take the village. It's going to take the whole state of Alabama working through it with all of our employees, everybody, working together to control it and to decrease the cases and those numbers, but mostly to keep people safe. I mean, we want our students and our teachers and our employees to be safe. I want my employees in public health to be safe. And so, number one, I mean, I think we've got to take care, of each other and take care of our employees. And we're going to do that. We're going to all do it together, but it is going to take a village.
Very well said, Jonna. Thank you.
Okay, let's move on. The next part that we're going to talk about is reporting positive and our suspected cases to Alabama Department of Public Health. And I am going to turn this over to Susan and let her do her job because she is an expert at this part.
So reporting positive or suspected cases to ADPH, ADPH has an online COVID-19 report card that is available for reporting positive or suspected COVID-19 cases. This link has been added to the school's K through 12 webpage. I'm going to go over a few important aspects of this report card. When you pull it up, it asks what reportable disease are you reporting, and of course this would be COVID-19 if that's what you're reporting. And the next question is, what type of case are you trying to report? For the principals and the school nurses in schools K through 12, it would be the third option, which is an individual with compatible COVID-19 symptoms and/or exposure to a known COVID case, where you do not have any supporting documents as far as the actual lab report. That is the option that the school nurses and/or the principals need to choose. All the other part, the patient's first name, last name, phone number, date of birth, those items, I mean, that's just self-explanatory, but it does have anything that has the asterisk and it says red must provide a value. You must provide a value. If you do not know it and unknown is a choice, then choose unknown, okay? The clinical information, it asks you if, did the patient experience any COVID-19 compatible symptoms? It's either yes, no, or unknown. And if you do not know, check unknown. Was the patient hospitalized? All of these, if you do not know the answer, which most of the time you may not know the answer to these questions, it is okay. You need to just check unknown because an answer, you have to provide an answer. Then the next part that's important is the patient associated with a school, university, or daycare? You want to check yes. And then it asks for you to give the school's name and what grade that they're in. Okay, that is real important as well. One thing is when you're providing the school name, if you use the ampersand, I guess I'm pronouncing that right, it will cause a problem with this form, so you want to spell it out, A-N-D, okay? So if it's, I don't know, Henry School and Daycare, you want to spell out Ann.
Can I mention something? Did you go over this form? I just want to mention that the box at the bottom of the potential outbreak and initial information in our toolkit, the very last, it's on page 21, the very last statement says ADPH does not routinely mandate school closures for outbreaks of infectious diseases. The decision to close a school is a local administrative decision and one that may be made after consultation with public health officials. I just want to make sure we don't forget that part because we are not in the business of closing schools.
Okay. So the report card is completed, like I said, by the principal or the school nurse on anyone who is sent home with COVID-like symptoms, or you have received a report that the student or a teacher has tested positive for COVID, okay? The next slide.
Can you get back?
Yes, I want to go back to the potential outbreak. A potential outbreak form is also on the school K through 12 webpage, and you want to report any suspected or known outbreaks, and we ask that you please use this link to complete this form. And that would be considered, an outbreak would be considered 2 or more in a classroom with COVID-like symptoms, okay? Or if you get a report that 2 of the students have tested positive for COVID, you would want to fill out the potential outbreak initial form. And in this form, the type of person completing the form, you would be considered a non-health department personnel. And the type of facility would be school and daycare. Now, it asks about the district of the facility. So if you do not know what district your county is in, there's a link and it'll bring you to that district investigator map for you to determine what county and what district that you're in. The next one, the estimated number of people in the facility. Now, this is not just the people ill, this is asking for how many people are in your facility. That would include the custodial, the staff, any assistants, clerical, it's everyone in the school, okay? And the next thing, the primary class of symptoms, if you're reporting COVID, you would choose COVID-19. That would be your answer there. And then the approximate number of people that are ill, that would be the total number you have ill. So you could have 6 students ill and 2 teachers, so you'd have a total of 8. And you would include them all in that section. But then where it says if separate units, they're wanting to know of the units that you have COVID-like symptoms or positive, you want to know what classroom has the most number of those. So if you had 8 people in your school that had COVID-like symptoms or have tested positive, then you want to look at the classroom. So you may have in Miss Sally's classroom of first graders, you have 2 students, but in second grade, in another teacher's classroom, you have 3 students. So you would be focusing on the one that has 3 in that classroom to answer this question, okay? And that would, how many people are in the unit with the greatest number ill, you would enter that there. Another question that seems to cause confusion is, was this associated with an event? So an event in your school would be if you had a classroom party and they brought in food to eat, or if you went on a field trip, which I know we're probably not going to be going on field trips, but that is wanting to know if this incident was part of a, was associated with an event. And then you submit it. Now, one thing I did not mention is that the seating charts for the school, for the classroom and the bus can be uploaded, and that's where you would upload that information where it says upload any pertinent documents. You would upload it there. And on the report card, you would upload it where it says to upload any pertinent documents.
And I think we've added the potential outbreak initial information, and these are the contact information that the school nurses are going to need.
Right.
And that's in the toolkit, and you can find your county and who you belong to contact.
As far as a district investigator.
Yes. So for time's sake, I'm not going to go over the rest of this verbatim, but what we did do is we have a section in our toolkit for cleaning and disinfecting. Everything that we pulled for the cleaning and disinfecting is from the CDC, and there's the handouts right there. I've already told you how you need to clean the buses, how you need to clean the classrooms. Items that are touched and shared need to be cleaned. I think the CDC did a fantastic job of telling us what to clean and how often to clean it. They even tell you how to make hand sanitizer if you don't have any. So there's a whole section for cleaning. The next section are the definitions and the concepts. And we put this in there so that if a school nurse calls a health department nurse or calls a case investigator, or if a parent doesn't understand any of the definitions or the concepts that we mention, this is definitions. I mean, it tells you what COVID-19 is. It tells you what a close contact is, face coverings, epidemic, high-risk populations. We tried to use most of the definitions that are used the most right now during this pandemic. I'm sure we probably left out a few, and we can add those as we go, since this toolkit is a living document and can be changed. The next thing in our toolkit is an Appendix A, and this is considerations for schools to consider when they're reopening their school. Again, All of the tools that are in this appendix are from the CDC. We felt like they gave great recommendations as far as things to keep in mind with if your county's in low risk, if you're in a more moderate risk, or if you're in a high risk, you know, following the color scheme that Dr. Harris mentioned earlier. So it just gives you some pointers to use, and we put those in there. I'm sure that most of the superintendents and school officials have already seen these. A lot of this was included in the roadmap with Dr. Mackey that was given to the superintendents. We pulled a lot of this information over. The cleaning and disinfectant was exactly what was used in the roadmap. And so the readiness toolkits and what's been pulled from the CDC is in there as well. And then we just put this general resource in there. And what this is, these are the handouts that we've been talking about the entire time. We tried to put in anything that would be appropriate for you to share with your students. The school nurses can post these. They can make posters for their isolation room, for their offices, just so that throughout the schools there's information available for our kids to see and for them to use, and for the parents as well. And we tried to do it age appropriate as well. And then the very last section of our toolkit. So we put together some frequently asked questions and the response. And so I'm not going to read through all of these, but over the last few months, these are a lot of the questions that we've been receiving. And I'm sure we've gotten a lot more questions that we can add to our toolkit today.
Oh, we have. I think we've gotten a whole lot of questions. And I'm going to also, Dr. Harris is still with us. And so a lot of the questions have to do, why are we requiring masks if you're still within 6 feet and masked and you still might have to be sent home? So what is the purpose of a mask?
And I did not wear my mask today because I wanted everyone to hear me, but we have kept our social distance, and I'm about to put it back on. But masks are very important. When I went over those key principles, all of those key principles are very, very important. Each one of them helps to mitigate, to help stop the spread of COVID-19. Masks protect you from someone that is sick. So if someone coughs, the mask is protecting you from those air droplets that might be in the room, as well as the social distancing. So 6 feet away and a mask, they both together help decrease the spread of COVID.
And I guess we've had several questions because they said if you have a mask and are less than 6 feet, is it not better to have the mask on?
You know, we need to do all of these measures, Carolyn, and I'm not going to get into which is best. I'm following what the CDC says. I'm following what our governor says. I'm following what Dr. Harris recommends. And the recommendations are that we social distance 6 feet, that we stay from large crowds, and that we wear a mask. You know, and all of those measures together, like I said, all of them together. Hand washing is so important. It's just as important as wearing a mask. So we've got to do all of the measures. You can't just say, I'm not going to wear a mask, but I'll stay 6 feet back. You need to do everything. Everybody needs to be doing as many of these measures as we can do to help decrease the spread. So I'm putting my mask back on.
Okay. Well, I have another question just as you're putting your mask back on. So is 10 days plus 24 hours for those who test positive, is that the same as 11 days? It's 10 days. Okay. It's
10 days.
So do you want to address that? Because when people hear 10 days plus 24 hours, you're really talking about 10 days with 24 hours being...
I have no fever and no medication.
Okay. Very good. And then we did have somebody else says it sounds opposite of what it should be. So if you're asymptomatic, if you're symptomatic, you go home for 14 days if you're a close contact. But if you test positive, you only have to go home for 10.
That's correct, and it is opposite.
Yeah.
Sorry. I mean, that's
So-
the guidelines, and, you know, Dr. Harris may want to address that more, but, you know, because if you're home for those 14 days, we know that if you're negative one day and you are sent home, you can still be positive and develop symptoms if you're asymptomatic. If you're symptomatic, do you want to address this more since you're the expert?
I would feel more comfortable if Dr. Harris, is he here?
Yeah.
Okay.
It is very confusing, though, and it is very confusing, and it's just one of those things that we're going to just have to.
Okay, while we are waiting for Dr. Harris, nurses, I
Thank you,
just
Dr.
want to
Harris.
I just want to reiterate that nurses are not doing any testing. We had a question about nurses doing testing. Nurses will not be doing testing. And so I just want to answer
Right.
that while Dr. Harris was coming up. Dr. Harris?
Sure. And so I guess the question has to do with what, if you're a close contact who has symptoms versus one who does not. I think the best answer to that question is if you have a person who is having symptoms and that person is getting tested to find out whether they're infected or not, that person is going to be under medical care. And I think you need to use the best guidance of the medical professional who's taking care of that patient. Strictly speaking, if you're a close contact, by all the descriptions that we use to explain what that means today, a close contact needs to be isolated from others for 14 days, period. A person who's a case, who's infected, needs to be quarantined at home for a minimum of 10 days after their symptoms started, with at least 1 day of no fever and symptoms improving. Now, at least 10 days doesn't mean exactly 10 days. If someone is taken several days before they start to improve, a person who's a case may stay home for 11 days or 14 days or 19 days. They have to be improving, and they have to be without fever, and then they have to be at least 10 days after. I think that it's a real specific question to ask, well, what if someone seems to be sick, but they test negative and we don't confirm them? Again, that's going to be a question for the healthcare provider that's taking care of that patient. I think it certainly may be possible that a healthcare provider might make a clinical diagnosis and say, even though we've got a test result that doesn't confirm it, I believe this person can clinically be diagnosed as a case. But that's going to be a case-by-case basis. It needs to be settled by that provider.
We also, I think there's some confusion under what's considered essential or non-essential under CDC guidelines.
Okay,
I have
sure.
to drop my mask a second. So are schools considered essential and are students considered essential?
Yeah, I see what you're asking there. Yeah, we get that question a lot. As you know, early on when there were shelter-in-place orders, there were sort of a delineation between what were considered essential workers and non-essential workers, which is a terrible term because everybody doing a job is essential. But that distinction was made because there were certain types of businesses and industry and government functions and so on that needed to continue running even though there were shelter-in-place orders. What CDC has said is allowed for the fact that there may be some circumstances in which a person who's a contact may have to work anyway, okay? This does not apply to anyone who is a case. If you are infected, you have to go home, period. It doesn't matter if you're essential or non-essential or anything else. People who are infected can't be in the workplace or in the school or anywhere else. They have to be isolated at home. For people who are close contacts, the guidance is that you go home for 14 days, period. There is actually not an exception to that. However, CDC has recognized that there were some cases in which personnel and HR reasons made it impossible for an essential function an essential business or institution to continue. And really what they had in mind were hospitals. Hospital workers get exposed sometimes all day, every day. And if every person who was a close contact in a hospital was sent home, there would be no workers at all, in a few days. So what CDC said was, if there were cases where personnel reasons required that workers be at work, even though you knew that they were close contacts, it was understood that they might come back to work. However, there were a lot of restrictions on what they could do. Those workers who are close contacts have to do frequent temperature checks. They have to whatever extent is possible, work by themselves away from other people, for example, in a closed office or in a way that they're not around other people. They are supposed to wear personal protective equipment when they're working around other people, and particularly that's true in a healthcare facility, for example. And they're supposed to get symptom checks so that they're being asked each day about what's going on with them just in case they are sick. They're supposed to have dedicated equipment, not share equipment or tools or things that they would use in their workplace with other people. So that's a very specific case. It's not preferred. CDC doesn't say that that's an equal alternative that's just as good. CDC says that if you're a close contact, you should go home for 14 days. But understanding that there may be some occasional situations where that's not possible, they do have that description. That I think is unlikely to apply in a school setting. Children are not essential workers. They're not workers at all. And so children who are close contacts should go home for 14 days. Workers in the school who are close contacts, I can't really think of an example where they would need to be brought back and stuck in an office alone and forced to wear PPE and continue their normal duties. That seems really unlikely to me. So whether or not a school worker is considered essential or not, the advice for close contacts is to go home for 14 days.
Thank you. And I've got one more for you, Dr. Harris. You reviewed the risk dashboard, and then in our toolkit we have the different scenarios, green and what the advice is, yellow. And so they are asking about on those pages 28 to 30 where the recommendations to avoid groups are. On the risk dashboard, either you're in the moderate risk category where you avoid groups of 20 or more, or the high risk category, which 50 or more. They just want to know how this applies to schools.
Yeah, again, it's guidance. It's not a hard and fast rule. Those rules that you see on the risk dashboard about gatherings weren't necessarily written with schools in mind, although schools were in mind just like other aspects of society. Those rules are meant to apply to society at large. And so, again, what we would ask is that you take that into consideration. You do your best to recognize those and accommodate those rules to the extent that's possible.
And then another question has come in a couple of times about school nurses who have been exposed. What are the isolation requirements for school nurses who have been exposed? Do we follow the CDC guidelines for healthcare providers, or do we follow the guidelines in the toolkit?
Yeah, they're essentially the same. I mean, if you're a close contact, then you need to isolate for 14 days. If there are situations in which it's totally impossible for the school to function by doing that, then as I mentioned a few minutes ago, there are some allowances for that. But that in most cases, school nurses are like other healthcare professionals, and we're going to try to isolate if that's an option.
Okay. A lot of information is being asked about special needs children, and so children with disabilities, we really are not, this toolkit, how would you advise special education teachers? This toolkit really has not been specific to that group.
Yeah, we did not specifically address that. I think obviously we think that these guidelines apply, to all kids and to all people in school. I think kids that have particularly unique health needs that make them especially vulnerable are the ones that we want to be most careful about protecting. The most vulnerable ones are the ones that we would like to avoid any risk of disease transmission to them if possible.
I think also that question might be posed back to Dr. Mackey. Jennifer, do you agree? Through the roadmap, I think that's been addressed.
Through the roadmap?
Mm-hmm.
Okay, very good. They also asked, here I have one, if a student comes to the nurse with symptoms, does the nurse also send the other students sitting near the student home too? And that would go back to our 1615 rule. Would that not be correct?
It does.
Okay.
The first thing they're going to need to do is isolate that sick child. And that's going to take them probably a few minutes to isolate that child, get the parents called, And then they're going to need to go back to the classroom and get that chart and immediately send that in to ADPH so that we can start working to find out who those close contacts are. But, again, don't you agree, Dr. Harris, that they're going to need to look at who's in close contact with the sick student?
Sure. Yeah.
And go ahead and send those home, because if they can bring them back, then they can bring them back. But the first thing, I think, is to go ahead and let them go home.
If they meet the definition.
If they
of being
meet
a
that
close
definition
contact.
of being a close contact, that's right.
So the next question is, when students are sent home either for the 10 days or the 14 days, who monitors when the students return to school? We have 3,000 students in our school. Many parents may send students back early.
I mean, I think that's a difficult decision that you make with all kids coming back to school. First of all, with a 14-day rule for a close contact, that's a hard and fast number, and there's not any interpretation to that. And if someone's a close contact, 14 days is the answer. For someone who's actually a case, it may not be 10 days. There's nothing magic about 10. 10 just happens to be the minimum number of days before someone is allowed to return. And I would assume that you treat that like you would any other illness. If a person's diagnosed with a disease, presumably they're seeing a healthcare provider who could help weigh in on that decision.
And if they're not seeing a physician, I think that's going to have to be, some communication between the parents and the school, the local school district, to find out. I mean, the child may not test, they may test positive on the weekend, and the school may not even know. I mean, absenteeism is probably going to have to be addressed too, on a local level, so that they can find out where the child is or where those children are if they are staying out, for a few days.
And I think there was some confusion too that I'm seeing in the questions about how we say that if a child is a close contact or they're symptomatic, they should go see their primary care provider. But people, I think, interpreted us saying they need to go home. What we're saying is, and I think that you all can address this, if you have a child that's symptomatic, you normally have a primary care provider for that child.
That's right.
Or they're seeing, they are seeing somebody that can advise them on that. So I just want you to address the runny nose scenario again, and I'm going to turn this over to Dr. Harris, because I think a lot of people are afraid that kids are going to be sent home unnecessarily, and that's why we're talking about the providers being a partner in this. Right. So.
Yeah, I mean, that's a situation that's going to require some clinical judgment. The school nurse is going to weigh in on how to evaluate that. There's not a flow chart that I think is going to apply in every case, and you're going to need the nurse who sees that child and knows that child to help weigh in on that. A child who has chronic allergies, who always has similar symptoms, who's presenting with similar symptoms, is going to be different than a child who does not normally have that problem, who presents with that problem. And so, as much as we'd like to give you a black and white answer on every potential case, I think the nurse is going to have to help weigh in on that. Clearly, if you have a person with an unknown illness and you don't otherwise clinically know how to evaluate that or diagnose that, then you need to see the primary care provider in order to do that.
Thank you.
I think, too, that we need to make sure that if a child is sick, that the parents hopefully will keep the child home and treat them at home if they need to, or take them to the primary care physician. And it may be that their nose runs for one day, they keep them at home, treat them for their illness that they have, and then bring them back the next day. So, but we do need to make sure that we educate the parents to keep their children home, and for staff to stay home if they're sick.
I have a question about a close contact. If a student has already tested positive for COVID, whether during the summer or recently, and completed quarantine, and they end up being a close contact, do they have to repeat another isolation?
To be honest, the science isn't clear on that right now, but generally speaking, we are saying yes, because it's not clear to us right now about reinfection, when that occurs, or if that occurs, how quickly that can occur. I would say we generally feel like people who are infected and who have gotten well are probably protected from reinfection for at least a few weeks. Again, there's going to be some clinical judgment involved, and we would suggest consulting with that child's primary care physician to help make that decision. Beyond a few months, though, I'd say we absolutely aren't sure about the risk of reinfection. It's certainly possible that it could occur. Again, I think every scenario is going to be a little bit different.
And the last question, because we're getting close to the end, I just want to reassure those of us who have joined this webinar that we will be answering all of your questions and that we will be posting those to the ADPH Schools K through 12 website. So all of the questions that you've all submitted will be addressed. So the last question is about extracurricular activities and also athletics. Can they use these guidelines for extracurricular activities as well as athletics?
Sure. I mean, these guidelines are taken from CDC guidelines, and they certainly apply to in classroom situations, but they apply to other situations as well.
And I will say on our school
K through 12, there is a resource that directs you to the Athletic Association for private and the public.
And I believe they came out with their own toolkit
Right.
recently.
And that is on our
Is that what
webpage.
you put on the? That's what you put on our. Okay.
Yes.
So it's on there, Carolyn, so that they can look at the web page at that toolkit.
Well, we certainly appreciate all of our speakers. Thank you so much. I do need to acknowledge that Jennifer Ventris is also in the audience today, and we will be sharing questions that were presented with Jennifer also. And we just appreciate you all joining us for this 2-hour toolkit review. This is a living document, and I just want to mention that because we will be updating it. Things are changing frequently. And as I said, we will have our team of busy bees looking through all of these questions that you have presented to us and making sure you receive an answer, which will be posted on the K through 12 website also. And I just want to let everybody know, and I think I'll turn this back to Dr. Harris, but this is definitely, I think, Johnny, you said it so well, this is about us as a team and a community dealing with a pandemic that we've never dealt with in our lifetimes. And this is difficult for everybody. And so I just want everybody to know, and I'm sure Dr. Harris has said this at the beginning, that we are here to support and that we're part of a team that wants to address this. So I'm going to turn it over to Dr. Harris for any final thoughts.
Yeah, I'll just say very briefly, thanks again for joining us. We appreciate all the people that helped put this together. It's a tremendous amount of work, but we also appreciate each one of you who are tuning in today. We have been through some really interesting times. We'll have a lot more interesting times ahead, but we want to do everything we can to support you and help you. And thanks again for joining us.
Thank you.
Thank y'all. Take care.